It's time again today for your health, a presentation of medical pharmacy, and we're proud to have in studio with us on this pre-recorded show, Allison Schwartz from Medical Pharmacy. Allison, we're going to talk back to school because, believe it or not, when people view this, some, if not all, of the kids will go to be back to school, depending upon which they see this on the first version or the second time it's played. But right now, you want to talk about something that's, especially in the medical news, and that is there's some articles, something out there about fish oil.
About fish oil, yeah. I mean, we've talked about fish oils before. I mean,
Yeah.
we use it for, memory, for depression, for arthritis and joint pain, for eczema, for autistic children. Fish oil has been proven time and time again over the years how beneficial it is for so many diseases and illnesses and problems. Well, recently there was this study released that said that fish oil causes prostate cancer, that it's very strongly linked to prostate cancer. And so we had a lot of people concerned and questioned, should they take their fish oil, should they not? What do you do about it? And what I want to first tell people is the study that showed this wasn't even studying fish oil. It was a select trial about the use of selenium and vitamin E to prevent prostate cancer. So, anytime there's a study, you have to really look at what are the statistics, when was it done, how was it done? And the most beneficial non-subjective studies are the double-blind, random, placebo-controlled trials. Okay. So it's really important to know that they took one study and then they retrospectively went back to look at it. After the study about selenium and vitamin E is over, they decided to go back and look at omega fish oils and the EPA and DHA levels in people's blood. So they're looking at two completely different outcomes in one study, which ought to right there go, well, it's hard enough to find one good thing out of a study. So how are you viewing something, especially after you've already done the study and you're going back and looking at it? So there's two different goals there. So you're like, if you have two different goals, how accurate really is the data? Well, there's a few flaws in the study. The first thing is it didn't even address whether the men who were in that study got their omega-3 fatty acids from a supplement or if they ate a lot of fish. There was really no proof that they were on fish oil at all. Okay, so they also didn't even look at their health status. Were they healthy in this study? So here's some stats from the study that link this. 53% of the people in the study smoked. 64% of them regularly consumed alcohol. 30% of them had a first-degree family member with prostate cancer, so high rates of family history. 80% of them were either overweight or obese. Now, all of those give you risk of prostate cancer, but we're going to say it's, fish oil's fault, which we disagree with. So there's no evidence that anybody took fish oil supplements. So we don't know, were they high-risk cancer patients that were told to take fish oil and did, and so that's why they have high blood levels, even though they're already a prostate cancer patient. So there was no comparison between people taking fish oil and prostate cancer to people not taking fish oil to see, is there any kind of difference? There have been multiple studies that shows that fish oil actually not only can prevent prostate cancer, but can actually help lessen it and keep you living longer. So this study was like, there's really no comparison between the two. But the most interesting way that they analyzed it is when you analyze an omega-3 fatty acid test to say, is your level where it should be, which they say your ratio should be less than 10 to 1. The average American is 40 to 1, saying we don't have enough omega fish oils, EPA and DHA in our diet. So you should look at the omega index, which is actually looking at your red blood cells to see how concentrated over the long term are those levels in your red blood cell. Well, they drew plasma. Plasma only shows very recent. Okay, so you really could have somebody that had never taken fish oil before until like the last week, or maybe the night before they went out and had a great big swordfish, tuna, salmon, the day before they had their blood drawn. It's very recent, so they maybe don't take it all the time. So you're going to say that because you ate fish one time and you had a high level of that in your bloodstream, because it does. It increases you 100% if you eat that stuff, but that's going to cause you to have prostate cancer. And what I look at that is, if eating fish and taking fish oil increases your risk of prostate cancer, then why did Japanese men who eat lots and lots of fish and eat lots and lots of omegas, why do they have the lowest rates of prostate cancer of anywhere in the world? So you really have to, when you see these news about whatever vitamin, whatever supplement, whatever drug does something either really good or really bad, you really have to review how accurate is that information, because they pull one little piece out and try to make you think that you shouldn't eat fish and you shouldn't take fish oil supplements. And I can guarantee you that I still take mine. So for anybody that has questions or concerns about should we take fish oil or what your questions are, please call us at Medica Pharmacy, and I'll be glad to one-on-one kind of explain why this study really was not very accurate, and why you should not stop taking your fish oil. That's the fish oil debate.
The fish oil story of the day.
That's right.
It sounded like they were fishing for some kind of results in their trial and test, and they weren't getting it in one place, so they went another. They were using apparently high-risk people for any type of health issue, but prostate cancer and all.
Yeah, but you go back after the study's done, and then you're looking at something that really doesn't give you the information you need, and you can't say that one dose of fish oil is going to increase your risk of prostate cancer. You just can't say that.
But some of those other things, smoking, drinking, hereditary, and
obesity. Yep. Obesity is linked to so many cancers, and prostate is one of them. And it has to do, on a little bit of a side note, is prostate cancer is a little bit hormone related, and when you are obese, you make bad estrogens and you recirculate those, and prostate is an estrogen related cancer. So anytime you're overweight or obese, you are automatically at increased risk of prostate cancer. Mm-hmm.
Well, let's get on a subject of back to school.
Back to school. I know by the time people watch this, Bardstown and St. Joe are in school. Nelson County's not in yet. I think next week, I think.
They go next week.
I think next week. I can't, I remember when I went to school, we didn't start until the week before Labor Day, and you went 2 or 3 days, and then you had a 3-day weekend. So this August 1st stuff is killing me. What happened to summer? And it's not even been hot, so it doesn't feel like it's been summer. So it's been wild. So we're getting ready to go back to school, and of course, every time you go back to school and you have all these kids enclosed in a room together, hugging and kissing and sticking fingers in noses, you get sick. And so, I'm automatically first of the year, we always think kids are getting colds, coughs, respiratory illnesses, strep throats. And we'll start with that one first, because the other one is something nobody really likes to talk about. But, cold is the most common, and it can be anything from just a runny nose to they can't breathe to they're coughing their head off. It could be a variety of things. So always you want to prevent. So I know that on our back to school list for St. Joe was hand sanitizer, and I know I've talked before that I am not a fan of hand sanitizer. I don't want my child to use it. I don't want to use it. I want him to wash his hands. But you have to get exposed to some germs, and hand sanitizer can be very damaging to the skin, so I don't like it. So wash your hands. Wash those kids' hands. Exactly. Put your children to sleep earlier. When you are tired or sleep deprived, and so many children are, because a lot of parents think that 9:30, 10 o'clock is a perfect time for a child to go to bed, and you have a young child, that's really too late, especially if they're having to get up anytime between 6 and 7 to get to school on time. That is not enough sleep for a child. So when you are sleep deprived, you raise your stress hormones, and makes you more prone to illnesses. So make sure that child's getting sleep. And good nutrition. We talk about this all the time. Get your vegetables, get your fruits, take a really good multivitamin. And Flintstones is not it. So, if you have a question about a good multivitamin, Sea Buddies is typically the one we recommend. There are a couple of other pretty decent ones, but don't just go grab some $2 vitamin and think it's going to keep your child from getting sick, because it's probably pretty poorly absorbed. Alrighty, drink lots of water. That's also going to keep you from getting sick. Keep that body hydrated. So let's talk about how a cold develops. First day, and most of us have had it. So for an adult, you feel it. You feel funny in your head. It's not like you're stuffy. You just feel a little odd. And sometimes you have this little tiny nagging sore throat. That's the first sign that you have drainage running down your throat and something's going on. So right around day 2, you start to get that runny nose. And with a cold, it typically starts out a little bit clear at first, and then you start to get the yellows and the greens and all the colors that you immediately assume are a sinus infection, and not always are. And then right after that, you start to get the cough, because as that drainage goes down your throat and irritates your throat and gets into your lungs and settles, you start to try to cough it out. Okay, so those are your symptoms for a cold. It is extremely rare to have a fever with a cold, but sometimes you can. But what I always want to tell people is, people are so quick with a child with a fever to treat it with ibuprofen or Tylenol. Remember that fever is your body's natural response to fighting off an illness. And most kids do fine with fever. You have a kid with 101, 102 fever, and they're running around the house playing. If they feel fine and they're playing and they're eating and they're fine, don't treat it. I mean, if it's 103 or 104, you might want to give them a little something. But the lower you take that temperature, the harder it is for the body to fight whatever it is it's trying to fight off. So a fever is a good thing and a bad thing at the same time. So my rule of thumb is I don't treat it at my house unless it's about 102 to 102 and a half. If the child's not complaining, they feel fine, I leave them alone. Just leave them alone, let them go. So if you're not sure of how to dose Tylenol and ibuprofen to your child, it's based on milligrams per kilogram. Well, here in this country, we weigh in pounds. Okay, well, you divide the pounds by 2.2. If you have a calculator, 2 is an easy number to remember, so dividing by 2 will be close enough. But whatever your child weighs, divide it by 2. And then for Tylenol, you're going to multiply that by 10. And ibuprofen anywhere from 5 to 10, but 10 is an easy number to remember. So divide your child's weight by 2, multiply it by 10, and that's going to give you the dose you should give them. Okay? Milligrams. Yes, milligrams. So, you have a 20-pound child, so 10 kilograms, that would be 100 milligrams. Okay? Ibuprofen is only dosed every 6 to 8 hours, and Tylenol can be dosed every 4 to 6. If you have a child with a really, really, really high fever and one of them's not bringing it down, you can alternate those two drugs. But again, the child's not complaining, doesn't feel bad. Let the fever run its course the best you can. Just make sure the child's eating and drinking plenty of fluids.
Is there a temperature where you say, okay, it's time to go to the emergency room?
It's funny. Actually, Dr. Hedrick and I had this conversation when my child got really sick last year. And I'm one of those, my child's never sick. So when he is, I'm like, wow, something's really wrong. And he actually got up to 104 and almost to 104.5 at one point. And I couldn't, I did give him stuff, and it really wasn't coming down, and he was pretty miserable laying around. And, Dr. Hunter said, if he seems to be okay, don't worry about it. I said, okay, I won't worry about it. So, we stayed at home. And, you can put a child in a cool bath, but I'm going to tell you from experience that when you're that hot, a lukewarm bath is freezing cold. Okay? So, you think, it might be refreshing. No. When your temperature is that hot, it is freezing cold. And so it can be kind of a traumatic experience for you more so than the child to try to get them in that cool bath. But please don't do it a cold bath. Please, anything cooler than body temperature is going to help. But when you're that hot, you get very dehydrated very quickly, and it's sometimes hard to get a child to drink. Pedialyte is your best option. Gatorades have too much sugars and too many artificial colors and stuff in them. If you have to use Gatorade, please dilute it 50% with water. So half Gatorade, half water, and little sips. Give them an ounce here and an ounce there, but just try to keep them hydrated the best you can. Don't worry about the food as much until the fever goes away. So we want to prevent this, right? We don't want to get a cold. So we said a good multivitamin. We said wash your hands and eat right, get lots of sleep. 70% of your immune system is in your gut. So put your child on a probiotic. Load them up for the first few days. Anytime you start a probiotic, if you've never been on it, you want to do a high dose for the first 7 to 10 days. So, if you're supposed to take 1 pill, we would tell you to take 3 for 10 days and then go to 1. We have little bitty encapsulated pearls that most children can swallow with no problem. And it is one of the better ones. It also comes in a powder. So if you have a child that can't swallow a pill, it does come in a powder form. The other there's two things I always recommend that you have on hand that are not necessarily preventative. You can use it preventatively. If you know you're going to go get on an airplane and maybe, people tend to get sick when they fly, there is a couple things you can use to prevent getting sick on the airplane. That's called ViraClear. It's also known as V-Clear. Sometimes the label just says V-Clear on it. It is one of the best things ever. That and a product called Sambuscus are two things that live in my cabinet at my house. So the minute you feel a runny nose, a sore throat, you feel odd, you start taking that ViraClear, and typically within 24 to 48 hours, you are symptom-free. I swear by it. We sell a lot of it. I have a lot of people that have had similar experiences with it. The Sambuscus is more for stomach viruses and the flu. But if you're not sure what you're treating, it's perfectly fine to dose them together. We dosed them together to treat the flu last year a couple of times, and it worked very, very well. So if you don't have ViraClear and Sambuscus in your medicine cabinet at home, highly recommend them. They have been lifesavers a few times for me. So great stuff.
Why people flying need ViraClear?
Just because you're in that enclosed recirculated air, you get some airborne viruses. So you have a lot of people that are just more prone. So it's just something to help fight off a virus before you get it. So you take basically... you take a dose, and you take a dose right before you get on the plane. Take a couple doses after you get off the plane, and you should be good to go. Yeah. So that's the cold. Strep throat is pretty much antibiotics and really, really sore throat and high fevers. Okay, that's strep throat. And you have a plethora of other respiratory illnesses that you get. But the one thing you tend to get when you go back to school that nobody really likes to talk about, and everybody kind of makes them start itching and scratching, is lice. Okay? So, unfortunately, lice is very common from children ages 3 to 12. Okay, that's the most common age range. And it is a parasite. So, I do want to debunk one myth. Lice do not fly. So if I'm sitting next to you and I had lice, you're not going to get it from me because they're not going to jump away from me. So
you have to block them.
Yeah, no, don't need it. Now we joke that if you were really drying your hair very vigorously, flipping that brush through there, that you may potentially be able to get it to fly through the air from your blow dryer, but that really doesn't happen.
But the lice is not going to like it either.
They're not going to like it either. They don't like hot things. So, but it's basically close personal contact, sharing personal items. So hats, brushes, combs, kids that get their heads together. And we're having trying to call us.
We have a phone issue.
We have a phone issue. It's a.
We'll get it fixed soon. There we go.
And we're fixed.
That was the lice calling in.
It was. Don't tell them. We want to jump on your heads. That's exactly what it was. But any personal contact. And the one thing is, every time you get something like lice or scabies, people immediately think dirty. Okay, head lice has nothing to do with where you live or how clean or dirty you are. It does not discriminate. It doesn't care if you have the cleanest hair in the world or dirty hair or live in a 5-bedroom house or if you live in a little bitty house. Lice doesn't care. So, do not panic if your child gets it. I think they say basically at some point in your life you're going to get some kind of parasite, whether it be a worm in your intestines, lice on your head, scabies on your skin. You're going to get something in your lifetime. Okay, so don't share stuff ever. Try to tell your children don't use other people's brushes, don't use their hats. Wash your child's head good. Look for these little bitty nits are hard to see. And then one sign that your child might have it if you don't see it is that if they have it, sometimes you'll see like where they've had their head laying on a pillow, or even on their clothes, like around the base of their neck. It'll be like a dark powder look that can indicate that they might have, kind of lice. And of course, it's very itchy. So you'll see some red bumps, and the child will be scratching their head quite frequently. Once you do get it, there are a few treatments you can do, and everybody's heard of Nix, and there's Rid, and there's all those. If you're one of those people that's not really a big fan of the toxic ingredients, because one, you're starting to see resistance to them, and two, they are pretty toxic. I mean, they can cause their own problems. There is a product called Lice Free. It has a combination of some tea tree oil, some other herbals, and some homeopathic products that help to destroy lice. They say it's very effective. I mean, knock on wood for me, I've not had to use it yet, but I think it would probably be what I would try first just to see if it would work. But it is a non-toxic lice treatment, so it might be something you might want to try if you don't want to stay away from the chemical route. And then you're going to want to, once you treat a child for lice, you have to typically retreat them in a week because those little lice lay eggs in your hair. And you can't really kill those little nits and those eggs until they hatch. So that's why you...
Story of a parasite, isn't it?
Exactly.
Fleas and other types of things.
Can't get rid of those little things, huh? Like, bed bugs. Good luck getting rid of those. They're a pain in the rear end. So, but you want to basically wash anything that you can wash in hot water. It has to be above 130 degrees Fahrenheit. And then you dry them in a dryer on the hottest setting that you have. If you're unable to do that, you can seal them in an airtight bag. You need to leave it for at least 2 weeks. And then you can take it off and, clean it with soap and water best you can. I'm a big fan of if you're not sure about a hairbrush, they're cheap, throw it away and go buy a new one. But everything else, wash it when you can. Vacuum your house really well. Any bedding that's on your bed, the night after you treat it, pull that off, wash it in hot water. And then, continue to kind of check your child's scalp just to make sure you didn't miss any of those nits. And then get one of those little nit combs because those are tiny. But that helps to pull the nits out of the hair, and a lot of those treatments actually help to loosen them a little bit from the hair shaft to make you able to comb them out.
So they're not health-wise dangerous to a child. They're parasites. Do they have some health?
The main thing is if you scratch enough, you always have a chance of breaking through that skin and giving yourself a secondary infection. So that is a risk. But, I mean, other than that, they drive you crazy, and everybody freaks out about it, and, nobody wants to get it. But, I mean, they are what they are, and you might get them, and it's nothing to panic about. Just go and treat them and know that you are not alone. I mean, I know in my pharmacy, we sure have a whole lot of boxes of the Nix that you typically use, the generic, because, we go through it a lot. It's very common, and typically, a lot of times by the time your child has it, and they have it, well, you've spread it to half everybody in your house. And so that's what really everybody upsets about is, oh my goodness, now everybody in the house has it. Well, it's unfortunate, but it happens, and it's just not the end of the world. So take a deep breath, treat it. You can always do, if you really, really want to not do any drugs at all, you can coat your hair or your eyebrows if you get them in your eyebrows or a beard. You can coat it in Vaseline and put a shower cap on and leave it overnight. But I'm going to tell you something, Vaseline is not easy to get out of your hair. It takes like Dawn dishwashing liquid. So you can look online. There's lots of options of things that, everybody says, oh, you can use mayonnaise and olive oil. The one thing I'd caution you about mayonnaise is if you are have a child that's been scratching and has, some scratch marks in their head, mayonnaise can actually give you a staph infection if you have an open sore. So be very cautious. If you're not sure, give us a call. But tea tree oils and different herbal products work very well.
The kids are going back to school. I don't know whether it's a de-stressing time for parents or a stressing time for parents. It depends. Some of them are like, whoa, glad they're going back. Some of them are sending them off for the first time maybe and having their own little issues.
Yeah, it's both. You hate to see them go back to school, and then, at the same time, you're like, okay, well, now my babysitter needs have greatly diminished, so, you got that going for you. But I know my little one says he's ready, so, yeah, we're ready. So.
Well, anything new you can tell us about medical pharmacy? I know that the annual health fair is coming up in September. I know we're a little early on that.
A little early. Never too early to start talking about it, though.
We're underway. Actually, have a meeting on it today. Medica very involved in that. Anything else new?
Two new things. We were just awarded, we got 2 awards from the Best in Nelson County. We did win Best Pharmacy and Drugstore, and we also won Best Medical Supply. So thank you to everybody who voted for us. We greatly appreciate it. We are honored again to be able to get that again this year, and just thrilled to death to get it. So that was one thing. And the other one I'm completely drawing a blank on. Oh, yes. We offer a free diabetes class at Medica, and we are right now trying to find a better time slot for it. When we first started offering it a couple months ago, the only time and spot we could get was at 4:30 in the afternoon on a Friday at the Nelson County Library. Well, nobody really wants to go into anything on 4:30 on a Friday, although we do have a few people that have come to every one, and they come to every class, and they've been great. But if you would take a second to either go onto our website, stop by the store, go onto our Facebook page. We actually have a survey. We want to try to find out, are you interested in doing the diabetes class? It is completely free. We share recipes, lots of tips. It's very informative. But we're trying to find out when's the best day, when's the best time, trying to find a second spot to move it to a more convenient time. But, by all means, stop by the pharmacy, free diabetes class, and we offer some great information.
Website's medicalpharmacy.net.
Correct.
And Facebook, just go on Facebook.
Facebook, Medica Pharmacy and Wellness Center, and you'll find us there in Bardstown. And if you're, out roaming around and you like to check in places, we typically pop up. I know we're also on LinkedIn and Foursquare. I would have to check with Garrett. I'm not 100% sure if those surveys are on any of our other sites, but I know that you can access that survey in the store, on our website, and on the Facebook page. So, let us know if you're interested, and we'll try to find a time that's a little more convenient, try to reach some more people to try to conquer the horrible disease of diabetes.
Allison, thank you very much, and have a great back